In this session of GPAT Kaksha, we will learn about cholinergic drugs. Cholinergic drugs are the drugs which act as agonist on the cholinergic receptors. The cholinergic drugs can be divided into two main categories, directly acting and indirectly acting. The directly acting drugs can be further subdivided into natural alkaloids, means which are obtained from natural sources, and synthetic compounds, which includes choline esters. The indirectly acting drug can be subdivided into reversible and irreversible. The reversible category can be further subdivided into carbamates and acridine, and the irreversible category can be further subdivided into organophosphates and carbamates. Indirectly acting drugs are those drugs which inhibits acetylcholinesterase enzyme and thus prevent the degradation of acetylcholine and prolongs the duration of action. Reversible means which reversibly inhibits the acetylcholinesterase, and the irreversible category which irreversibly inhibits the acetylcholine esterase. The directly acting drug directly interacts with cholinergic receptors to produce parasympathomimetic or cholinomimetic action. Parasympathomimetic action or cholinomimetic action means the actions which are produced by acetylcholine on cholinergic system, means the actions of cholinergic system which we have already learnt earlier. So all those actions are produced by directly acting agents by directly interacting with the cholinergic receptors, that are nicotinic and muscarinic receptors. The directly acting drugs are of two types: natural alkaloids, which includes acetylcholine, muscarine, nicotine, pilocarpine and arecholine, and synthetic derivatives includes methacholine, carbachol and bethanicol. Bethanicol is used for treatment of urinary retention, means in patients of urinary retention, non-obstructive urinary retention. Non-obstructive means the urinary retention is not due to any kind of obstruction in the passage of urine. It is due to a post-operative kind of or postpartum kind of urinary retention. So bethanicol is used in treatment of urinary retention. Pilocarpine is used as miotic. Pilocarpine is used as miotic, hence it can be used in treatment of glaucoma. Indirectly acting agents increases the availability of acetylcholine and prolongs its duration of action by inhibiting enzyme acetylcholinesterase. This enzyme acetylcholinesterase is responsible for degradation of acetylcholine. So these drugs inhibits the acetylcholinesterase either reversibly or irreversibly, and thus increase the availability of acetylcholine at the receptors, at the cholinergic receptors, and prolongs its duration of action. The indirectly acting drugs are of two types: reversible. Reversible drug inhibits the acetylcholine esterase and prolongs the duration of action of acetylcholine. These drugs reversibly inhibits the acetylcholine esterase enzyme and prolongs the duration of action of acetylcholine. These includes carbamates, pyridostigmine, neostigmine, idrophonium, physostigmine, ribostigmine, donepezil and galantamine. Out of these, pyridostigmine, neostigmine and idrophonium are water soluble, while the physostigmine, ribostigmine, donepezil and galantamine are lipid soluble. Another category is acridine, which includes tacrine. Physostigmine is used as miotic in glaucoma. Physostigmine is used as miotic in glaucoma. Neostigmine and pyridostigmine is used in treatment of myasthenia gravis. Myasthenia gravis is a disease in which the antibodies get developed towards the cholinergic receptors. So what happened? At the cholinergic receptors, the antibodies get bound and the cholinergic receptors are not free to bind the acetylcholine. Thus, this leads to fatigue in muscles or muscle weakness. So, myasthenia gravis is an autoimmune disease in which antibodies get developed towards the cholinergic receptors. So, in that case, neostigmine and pyridostigmine, which increase the availability of acetylcholine at the receptors, are used in treatment of myasthenia gravis. Idrophonium is used as diagnostic agent for myasthenia gravis, means to determine whether the patient has muscle weakness due to myasthenia gravis. Idrophonium is used as a diagnostic agent. Tacrine, donepezil, rivastigmine and galantamine are used in Alzheimer's disease. These drugs are used for treatment of Alzheimer's disease. Tacrine is used rarely these days, whereas donepezil, rivastigmine and galantamine are preferred. Irreversible cholinesterases are not used therapeutically. Generally, irreversible cholinesterases are not used therapeutically except ecothiophate. Ecothiophate, which is sometimes used in treatment of glaucoma. So, ecothiophate can be used sometimes in treatment of glaucoma. Otherwise, the irreversible cholinesterases are not used therapeutically. For practicing MCQs and to learn important one-liners, follow GPAT Kaksha on Instagram. The link of same is given in description. Study well, keep yourself motivated, always keep smiling. Stay tuned for next topic, that is anticholinergic drugs. Thanks a lot.